This video will take you through a step-by-step guide on how to rehabilitate after a fifth metatarsal fracture. Please remember all information in the video is for educational purposes only, and any information in the video shouldn't be used to substitute medical advice. So normally these exercises are performed after you come out of a boot. So typically most metatarsal fractures are in a boot for up to 6 weeks. There's a period of time where you might be able to do some non-weight bearing exercises while you're still within the boot, and they're the first exercise that we'll cover. Again, you should check with your medical practitioner before you carry out any exercises like these. Then after that you'll progress onto more weight bearing exercises, some stability exercises, and then finally we'll progress onto more advanced rehabilitation exercises. Throughout the video, try to listen to the audio carefully as we explain in detail how to perform each exercise, and then I'll come back to you between each stage so that we can talk you through when you can move on to the next step. So this first step is usually performed between week 4 to 6 depending on the type of fracture and where it's located on the fifth metatarsal. There are simple exercises to increase engagement of the muscles and tendons around the foot. They should be performed in a pain-free manner, both slow and controlled to have the most effectiveness. You might not necessarily experience complete fatigue when you carry out the exercises, it's more for motor control. The aim of the first exercise is to strengthen your posterior tibial tendon which sits on the inside of your ankle. It's a key stabilizer, and to stimulate it, you lift your foot up and down against the resistance of the band. The next exercise is another version of strengthening this muscle. So you'll lift up against the resistance of the band, and when your foot's in neutral, you just bring it back and forth in a slow and controlled manner, trying to make sure there's minimal perturbations of the foot. Following this, we aim to strengthen the big toe. So place the band around your big toe, point the foot down, followed by a big toe, and then slowly return to your starting position. At this stage, you usually have spent 4 to 6 weeks in the boot, so your toes are often cramped up inside, so it's important to work on the small muscles of your toes by practicing spreading them out and back in again. If you've done this for 2 weeks and it's been pain-free, then you can typically move on to more weight-bearing exercises. Progressions of exercises should be done under supervision of a medical practitioner, and they should be also pain-free to perform. So the next stage of exercise is typically done between week 6 to 8 or 6 to 10, depending on what stage you're at. There's a mixture of balance, strength, and stability exercises. Again, slow and controlled is preferred, and always in a pain-free manner. At week 6, we can usually begin to strengthen the peroneal muscles, which attach onto the fifth metatarsal. So using one foot as an anchor, turn the affected foot outward in a slow and controlled manner against the resistance of the band. Another version of this through range is using a slant board, or you can do it off a step or a book, and just lift your foot up and down, trying to hold it in a neutral position while you apply resistance from the band with your opposite foot. Slow and controlled and pain-free throughout. The next exercise is simple calf strengthening. You'll get atrophy or weakening of your calf from spending so long inside the boot. So begin with double leg heel raises. So slowly up and down, getting as much height as you can, equal on both sides. And when you can comfortably do the rep range, you should try to progress onto single leg on the affected leg. It's good practice to try and strengthen both sides. So focus on getting the full range throughout. Think about going 2 seconds up and then 2 seconds back down again. After spending so long in the boot, it's important to stretch your calves, so you can stretch your gastrocnemius by keeping your back leg straight and leaning forward on the front leg. And then to stretch your soleus muscle, which lies beneath the gastrocnemius muscle, you adopt the same position, but you just bend the back leg and you should feel the stretch lower down towards the Achilles tendon. Balance and proprioception can be severely affected by this injury. So first of all, practice standing on one leg, aiming to hold for up to 60 seconds, supported then unsupported. You can then progress onto a balance exertion exercise. So stand on your affected foot, try and bring your foot forward, back, out to one side and then to the opposite side, trying to maintain a stable ankle throughout, and you can bend your knee slightly to make the exercise a little bit harder. If you completed the last set of exercises for 2 to 4 weeks in a pain-free manner and they become progressively easier, then you can usually move on to the final stage of rehabilitation, which is carried out anywhere between 8 to 12 weeks. These exercises require greater force, greater stability, and place greater stress on that fifth metatarsal, so it's really important that it's completely pain-free to perform, and we always ask our patients to let us know if they get any changes or any subtle differences in swelling or in pain. So this is a progression of the strengthening of the big toe that you've done in the first few weeks. It's in a weight bearing position. You can do it on a step or on a bench. Stand over the edge of it and slowly bring your big toe up and down. You can progress the exercise by standing on one leg, first holding on and then weaning off the wall. To really stimulate your ankle stabilizers, use a band against a radiator or a stable object to pull against your ankle while you go up and down on one leg. First pulling from in to out, and then the second version will go from out to in. This challenges your perineal muscles and your posterior tibial tendon to help stabilize your ankle as you move to your range. Try and do it with the wall and then without the wall. Then we move on to progressive balance exercise. So the previous star exertion balance exercise moves on to a wobble mat. If you don't have this available to you, you can use a cushion or double over a pillow at home. Try and keep your ankle stable. Just touch down gently on the floor while you move through a range back, forth and to both sides. Finally, we move on to some hopping, which really strengthens the bones. So try double hopping initially and then progress on to single hopping. It should definitely be pain-free to do. So hopefully that's given you an idea of what rehabilitation in our clinics looks like for fifth metatarsal fracture. If you have any questions, please leave them in the comment section. And if you found the video helpful, please like and subscribe to the channel. We got more information on fifth metatarsal shoes and rehabilitation after a fifth metatarsal fracture.